Okay, well, making a runner. Now we've got all the boring stuff out of the way. Now we're getting all the stuff you guys want to know. Oh, you're reading that. Why is that? Anyone want to any specific questions they just want to ask out loud, then we'll do the other ones? Yep.
I just want to know about the meat. You've got here 20% of the diet, right? It's got every meat I have.
Yeah, pretty much all of the above.
We eat meat every day.
Yeah.
For energy.
Yeah. No, you've got to have some. I mean, vegetarian diet's great, but see, if you, it also has its downfalls as well. You know, if you don't make a complete primary protein by combining the right type of vegetables and nuts and seeds and lentils together, you can actually make yourself very, very sick. Vegetarian diets are very low in nutrients like vitamin B12 and taurine. For a guy, they are probably singly, next to zinc, is singly the most important nutrient. Actually, I didn't mention, to really get into much talking about nutrients. In my opinion, zinc's the king. Yeah, even more important than folic acid. I mean, folic acid is, everyone knows about it. They all talk about it. You know, there's certain vitamin products that they represent.
Sorry, just let me interrupt. You're talking folic acid and zinc. Are we talking for both?
Yeah, it's really good for both sexes. It's really important. I mean, in the past, it's always been thrown on the girls. You know, you've got to have zinc, especially if you're getting a bit older. You know, it's essential. You know, to prevent neurotubular defects and things like that. But see, it's all about the balance. And there's, again, this is when you look at like preconceptual multivitamin supplements that are on the market, and there's one that they promote very much, which is I'm not a real fan of. Starts with an E. Yeah, did you hear it from me? Great folic acid content, but sadly at the sacrifice of the rest of the other ingredient in there. And what really irks me is that when we were talking about genetics before, about how like RNA and DNA or genetic material and how it replicates, you need the right balance of particularly folic acid and B12. And there's certain supplements I find are not balanced very well. And what they've been finding, actually they've been doing a lot of studies, if you believe studies, they were having like amniocentesis tests, like doing genetic tests, and they were finding that they were coming back with a much higher percentage of false negative readings with certain people being on certain supplements. Yeah. And I have to say, in its defence, the product was put out before these studies were done. But I think that particular supplement really needs to go back to the drawing board and get done again. I think it's great, but I think it's paying for a lot of people's trips to Tahiti every year. Anyway, we'll move on for that one. But folic acid and B12, but zinc is essential. And again, when you look at a lot of the foods generally on the charts there, a lot of the high zinc foods are usually going to be in the upper portion of it. You'll find foods that contain B12, which is mainly in meat products. Obviously, flora contains the folic acid and things like that. So if you overcook the foods, you can damage the folic acid. But ironically about folic acid, your body stores folic acid in the body. That's, again, why preconceptual nutrient care is very important before you fall pregnant. And again, particularly in the first trimester of the pregnancy. Most of the cells of embryo while it's developing is mainly occurring in the first trimester. After the first trimester, we're sort of out of the 90% out of the woods part then, and really the embryo's just got to get bigger. Most of the vital organs and that are pretty much sort of formed by that stage. The thing is that, your body will store the folic acid for about 6 months anyway. So if you never touched another thing with folic acid in it, you're probably still out of the woods. And you'd be right. I mean, you'd be on the dregs by the end, And that's why they do say with a lot of couples, within a calendar year after childbirth, not really that wise to try and fall pregnant too quickly afterwards, because it takes about a year of getting back onto a balanced diet to actually regenerate that loss in folic acid. Even though you could be taking tons of it and it's coming out your ears throughout the pregnancy. You still may be deficient after childbirth. That's why it's very wise. Like a lot of couples we sort of support them through the different stages of the pregnancy. We've sort of been talking about falling pregnant, but it's all about maintaining the pregnancy as well. And I tend to break things down into the different 3 trimesters, and the mum's nutrient requirements and the baby's nutrient requirements do vary during the different stages. And usually once we hit the last trimester, we start to prep couples and getting ready for the big day. You know, hopefully if they take a bit of time off the labour and that, and help them, and you know, if they want to, you know, breastfeed or anything like that, there's a lot of things we can do to help improve the quality of the breast milk formation and all these sort of things as well. So yeah, so that's pretty important. I probably didn't answer that at all, but yeah. So what was that again? I go off on tangents.
Just the meat.
This is what I do.
The meat, because it's in 20%. I mean, if we have it daily for say lunch and dinner.
I'd still have a bit in, yeah. Well, usually if you can restrict it to 1 meal a day, that would be pretty good. Because you can't overdo it. It's mainly because I'm probably more aware of the meats. If it's a white meat, it's not so bad. I mean, it's good if you can change it up a bit. You know, we're on the downs here, you know. You know, like I come from this area, I would die if I didn't have meat daily. So I think the problem is we don't know what's happening with the processing of a lot of the meats. And a lot of them are pumped with a lot of hormones and stuff like that now. So it's like anything, it's like moderation, you know. The whole secret is usually rotation. This is actually how a lot of people break an allergy cycle. If you eat a lot of one particular food one day, don't have it the next. Okay, that's how you expand your repertoire a little bit. You know, because a lot of us sort of stick with the same foods every day. I don't know about me. I cop the same dinner every other night. Sorry.
I don't do it.
Didn't hear that. We can edit that. You know,
wife's defence.
Yeah. We can edit that. So, yeah. Personally, it's good to have a bit of meat in your diet. A bit of protein, preconceptually, I think is very, very important. It is actually one of the most important things. And protein at the end of a pregnancy is very important. You know how they talk about eating for two, it's really a lot of crop. It's more important to up your protein intake by about 200 calories a day when you get into your last trimester. Because it's interesting, when you're in your last trimester of a pregnancy, the amount of fluid going through your kidneys in a day increases by about 100 litres a day. We're talking massive, massive big changes that go on. So protein is very important for that, and protein actually helps prevent a lot of fluid retention, especially believe me, at the end of a pregnancy, you don't want that. Especially if it's the guts of summer when you're due, yeah, you don't want that at all. So yeah, bit of meat's great. You don't want to be a Nazi about being too strict about these sort of things. You know, I think that's where you get into strife. You know, if you don't want to make big dramatic changes with people too much, because one, you're not going to stick to it. It's like doing elimination diets and stuff like that. I mean, it sounds good in theory, but it's softly catchy monkey. That's how you do it. Just make these subtle changes little bit by little bit. Then yeah, we usually hit the money in the long run. Yeah, I think it's a bit closer to it. Okay, anything else?
Just a quick question on more the fitness side of things. If it, like me personally, my brother and a couple of other guys I know, we do a lot of sports mainly during now, like rugby league and weightlifting and all that. Yep. And then after we don't do as much, like a big peak and then drop.
Yeah, when you footy season after that,
so with that big peak and stuff, is that going to cause a big effect on it?
Can do during like when you're getting into the end of the season. Probably more when you're doing a lot of probably more the fitness training part of it rather than the strength training part. So probably again more with the bodybuilding aspect. Because usually if you're putting on muscle mass, you're doing heavy weights and low repetitions. Rather, when you're building endurance and stamina, you're doing the opposite to that. Actually interesting, because probably the second lot of occupations, if you could say, for males, with that you generally see with fertility, next to guys in tradie type of industries like your sparkies, your truckies, your plumbers and all that, they probably make up the #1 group of couples that we see that usually come in, and again, heat, heavy metals, petrochemicals, they're all exposed to this stuff. Athletes probably come in a close second or third. We get a lot of top class athletes coming in, get a ton of cyclists, holy, I was going to say something. A ton of cyclists coming in, they get our lycra gear on, they look really good, but oh look, the fluoro, you look good, and they're getting there, it looks really flat, but yeah, I don't know, but a lot of them, a lot of partners that we see, and that, but the same too, footy players, a lot of it, actually we get a lot of the wallaby players, we get a lot of top footy athletes that come in, and yeah, they're aren't firing too flash. So yeah, it can be a bit of an issue with the overheating part of it. You want a bit of supplements, you know, you take a bit of creatine or something for the bodybuilding, protein. Yeah, that's all right. Most of that stuff's all pretty good, just as long as you go. You want any? No, I shouldn't. Yeah. No, that shouldn't be a big drama, but probably when you're getting into the season, you know, because of more intense training, by the time you get down into it, then you might be starting to get into a few troubles there. Not so much at the beginning part of the year, but, you know, yeah. So it can definitely, that's where cold showers come into it. You know, get the old bag of peas treat afterwards. Yeah. Yeah, just as long as it doesn't have dry ice on it, then you know about it. Get the spam out. Anyway, lift it up. Does that sort of cover most of what you want to know there? Anyone else? Yep.
20-something cycles over a 6-year period with Dr. Esler.
Yeah.
IVF ICSI. He had
ICSI, oh, okay. Sorry, 6 cycles, you know. No, sorry.
Over 6 years.
Oh, over 6 years.
20-something cycles.
20-something cycles. Woo.
Shut down our throat every month.
Yeah.
It was never a problem to have continuous month after month after month treatment.
Yeah.
Which totally contradicts.
Were you on? Were you doing stimulation cycles like Clomid or drugs like that?
No.
So they were just monitoring ovulation, and then what they did is sperm pick up most times.
Yep.
And you were doing this really that consecutively?
Month after month.
Oh.
In 2009 from January to November.
Yeah. Oh.
He said there was no problems with that, but you do it month after month.
If there's not a lot of drug cycles, you can understand if you were using lots of rounds of Clomid or a similar type of down regulation drug, that consecutively afterwards, I'd be a little bit concerned about that. Again, it's good working a bit on the sidelines because you can see a lot of things and you know what a lot of the top gynos are sort of doing around the place, but that's a very, personally, it's a bit of an old hat way of doing it.
But we placed our faith in him that he knew.
Yeah, I'd say, I mean, I don't want to knock what Dr. Esler's done. He's probably made a lot of babies over the years. I would approach it very differently. I think you need to probably stretch those cycles out. I wouldn't encourage anyone to go back because from what I've seen, like we were just sort of mentioning before about the immune compatibility thing, I mean, they're sticking things in places, these things were really not meant to go. And if you're doing that too regularly, this is how the antibodies will start to increase regularly like that.
Is that just with IVF or?
Well, even with the IUIs, not as probably dramatically as the IVF, but they are still sticking foreign bodies in your body, you know, and your body, you know, again, it can recognise that this thing's not supposed to be here and can then start mediating an immune reaction against it. So, yeah, I'm not a real fan of back-to-back cycles, especially stimulated cycles. You know, obviously when you're going through IVF, you know, they usually hit you, well, again, again, a lot of it depends on age and body mass, and, you know, there's a lot of things they should be taking into consideration when they work out what dosages of drugs and what drugs and when they're going to administer the drugs. I'm not a big fan of some, you know, like Clomid, for example. Clomid's most people have heard of Clomid? Yeah. It's one of the first line of treatment protocols, girls that have PCOS. Yeah, number one drug they tend to bring out. I mean, if you actually look at the drug, it's biochemical. It's actually a lot of info in the book. It's biochemically identical to another drug that was banned at the end of the 1970s called DES. And actually, all people, even though it has been used commercially for 30 odd years, if everyone was tested, we'd still find trace elements in their bodies. So we actually do pass it on down the genetic line a bit. With Clomid, for example, this is just my opinion, but if I'm sort of using it, you know, I never do more than 3 months run of it back to back. Okay, it's a bit like trying to drive your car with the foot on the accelerator and the brake at the same time. You're not going to go anywhere too quick, and you've got a potential chance of burning out your engine. Game over. You're in big trouble.
Are you talking about like the same milligrams per?
Yeah, well, even just using it. Sometimes they use a bit, and sometimes like they'll use it. They usually, well, hopefully they'll come in at a bit of an entry level dose. see how you respond. If not, then they usually take it up another notch and another notch. But the drug itself has a long half-life, which means it actually absorbs into your body's fat tissue. And the thing is that even though you might be off it for long times, when your body starts turning over new tissue, the residue of that drug can potentially reabsorb back into your bloodstream, and it can cause absolutely havoc on your hormone feedback system. You know, so it can be a wonderful thing. Like girls that are not having any period whatsoever, it really should only be used really when girls their periods are absolutely incredibly irregular, or you're not menstruating at all. That's really when it should be pulled out of the bag. But it seems to be, sadly, you know, it's an old drug. It's been around for a long time, and they really haven't come up with another version in recent years that's I hate to say the word safer version. The cruel irony, when you look at this, again, get into statistics, the birth defect and miscarriage rate of overusing Clomid, which basically means more than a year of using it, is more than double the national average for natural conception. What's that? Birth defects, yeah, and miscarriages. So it can be a wonderful thing if it works well after the first couple of goes, but if the conception really hasn't taken place in that time, back right off, if it was me.
What about letrozole? Is that the same as Clomid?
Which one?
Letrozole.
Yeah, similar thing. A lot of it like Serenol, Serenol, yeah, it's the nasal spray. A lot of them, because Clomid's got a bit of bad publicity, now they're sort of marketing under a different name. It's pretty much essentially doing the same thing. The other thing is the down regulation. Like if you're going through IVF and then they do that, you do probably Clomid from day 2 to 6 or something, 3 to 7, a few days of that. Then they do the ovulation monitoring, see how the follicles are going. Then they put you on FSH-based drug to help down regulate. Again, FSH does also come with its downsides. One of the big problems is hyperstimulation. I don't know if any girls are familiar with that. It can be very, very dangerous. I mean, they're learning more in the last few years. They're starting to catch up a bit. Sadly, they're about 5 years behind, I think, in many clinics. And it's like anything. When you've been in the game for a while, not knocking Dr. Esley, he's probably done some great things, but, they'll say that about me. With distillery. You sort of stick with what you know, but you sort of get stuck in a bit of an era, and you don't sort of keep up with all the latest changes and stuff. And some of the stuff that I see a lot of practitioners still using, personally, I find a bit very archaic compared to what we do use today. But yeah, the FSH drugs, see, obviously because they're trying to purge the ovaries to try and retrieve as many eggs as they possibly can, obviously so they can put a few on ice, freeze them in cryogenic, so they can dip back in that. If that IVF attempt is not successful, then you don't have to go back through the full stimulated cycle again. So that's basically what they call the frozen transfer when they go back. Personally, I'm finding the frozen transfer cycles working so much more successfully in the last couple of years than even the fresh cycles. And mainly because of all the drugs you loaded up with leading up to it. One of the byproducts that I worry about with the FSH drugs, again, I'm only saying this when it's completely necessary, but like I say, there are other tricks you can try, is the byproduct of that, when you're purging the ovaries, you're releasing a lot of fluids. And theoretically, if you consider, like if you're naturally per month probably ovulating and only losing 1 or 2, actually most people don't know that, when you ovulate, you don't actually lose just like 1 egg every month. You lose that 1 egg that dominates and becomes the dominant follicle and you ovulate with it. But then you lose about another 500 to 1,000 more immature eggs. They call that atresia, okay? So when you add that up over the years, even though you've probably got 1 million eggs to play with, and we only want a couple, goodies, hopefully, but when you, like I say, that's when it happens, when you get to the magic mid-30s, that really accelerates. And the thing is, when you consider with IVF, what they're trying to achieve in 1 month is sort of physiologically what your body would usually take a year to do. So if you keep smashing it like that, more doesn't mean better, so because usually there was problems to begin with. And this is fine. You're smashing it with these hard drugs, and all of a sudden, okay, you fall pregnant, then you back off those drugs, and all of a sudden you think, oh, Maybe if you sprinkle fairy dust on the situation, everything is just going to be fine. Your hormones are all automatically going to balance itself and everything's going to be fine and dandy. But the sad reality, that's not the case. You know, that's why prepping is so important. And the big thing about this FSH is the fluid that your body releases. And that can be potentially very dangerous. It can make you feel very sick. You know, in the past it used to kill you. You know, that's a long time ago. We're getting better at it. But the thing is that we can use tricks to help move that fluid away. Because even if girls don't get a lot of hyperstimulation, even if they get a little bit, there's still more fluid hanging around by the time you do an embryo transfer, okay? And that's not good. We were talking about before about circulation and blood flow to the uterus. Well, embryo doesn't like that very much at all. Again, when you consider, you know, we're talking about the sperm, they like it nice and chilly. The embryo likes it nice and toasty warm. You know, like the krill iron, you know, it's really like an incubator. You know, it's like these little chicken hatcheries, you know, and the embryo really likes it nice and warm. And if you've got this extra fluid hanging around, it's congesting and constricting the blood flow to the uterus. And the embryo is relying on what it can draw from that uterine lining. If there's something that's blocking that, it's not going to like that very much at all. And things, again, can go from bad to worse really quickly. So it's a catch-22. But that's a lot of cycles done. I mean, we've had couples that have had, you know, in the 30s. I think in the book, one of them we talk about 34 goes, and she was 48 when she tried and fell pregnant. So, you know, you just got to think your way through the solution. Hopefully 9 times out of 10 you've got to be able to get there in the end. But yeah, I mean, I would have probably done it very differently if it was me. Yeah. So we end up, oh no, I go off on tangents. It's, you know, did I end up covering what we were talking about?
So with the AI, they can do that without drugs?
Yeah, usually. See, the era of drug-free IVF's really just a few years away, you know. But again, you know, there's not a lot of shopping days left till Christmas, so sometimes some of us don't have that time to sit around and wait. So, yeah, but I think, not to say, but they probably get a little bit lazy doing that. You know, they just like doing it. They've got a certain protocol they like sticking to, and you know, they like doing it because they have more control over the situation. When you're doing ovulation monitoring, doing like a natural cycle, and they're sort of just hoping that you might ovulate under your own steam, it's not as precise as what you would do if you were doing like a drug protocol, because they're sort of in a way synthetically taking over the function of what your natural hormone system should do. I mean, like I said, that's fine and dandy maybe for a few goes, but when you've got to start doing that too many times in a row, more doesn't mean better. You then start getting into big troubles. And instead of improving, you know, your hormone balancing and that, in a way, it's throwing a big spanner in the works and can make it even worse. So, yeah, everyone's in a very different. That's why it's an absolute endless abyss when you talk about making babies. You know, when we're putting the book together, I mean, the research we have is this wide. You know, we could have made a book this big easily on the subject. There's nothing like it. For one, it's a 2 for tango deal. But when you get into the possible causal factors for men and women that can potentially cause why we don't have babies, it could be almost anything. It's almost anything. But you don't want to sort of read too much into it, because if you get too pedantic, you know, you're going to get further away from, you know, getting what you want sometimes. But yeah, with IUI, yeah, they can do that. They can just, you know, do ovulation monitoring with the ultrasound. Think, okay, you're going to probably ovulate on this side this month, okay, and they get pretty much a prediction what day that's going to happen, and they get the turkey baster out. And a lot of time they can help read the cannula. Okay. I like the turkey baster. Yeah, I'm very technical. You get they can sort of edge the cannula down that side. It's actually amazing how the body works, because when a woman ovulates, the egg itself actually releases hormones that actually attract the sperm to actually swim in its direction. I mean, it's amazing how that happens. But yeah, they can sort of improve the odds by pushing more sperm down that way. You know, but see, again, there's other conditions. You know, there's things like fibroids. You know, a lot of people, we talked about endometriosis briefly and the PCOS, but fibroids, you know, is becoming a real big problem as well. Fibroids are like growths, you know, big cystic masses that can form within the uterus. And again, if an embryo is trying to implant on that, it's going to find it very hard to sustain a lot of nutrients. And again, fibroids are basically caused because of years and years and years of menstrual cycles. One of the big problems once you hit generally the mid-30s and upwards, most girls suffer what they call estrogen dominance. So it basically means you're carrying over a little bit more estrogen every menstrual cycle you have because the old liver's not, working like you used to. So you get this sort of raised gap between the estrogen and progesterone. The main thing that also causes most of your PMS symptoms, it's that gap between the estrogen and progesterone. But the more and more your tissue is exposed to this hormone, it's going to start becoming abnormal, like breast cysts. Similar sort of things can form as well. But again, it's all part of this stagnation problem, circulation. A big part of this is making sure with girls that the liver's filtering very well, because we want to help make sure we clear that overload of estrogen. Really, estrogen is not our friend when it comes to making babies, because it's the progesterone after you ovulate that's released from the corpus luteum, that's the cavity where the egg comes out from, that's where your progesterone is then made from after you ovulate. Because if you don't ovulate, you don't make progesterone, and that's why you don't have a period many times. So, so basically, yeah, we want the progesterone to come up because the progesterone helps to tell the brain if your pregnancy takes place, okay, yes, you are pregnant, maintain the pregnancy, okay? And it will also help to sort of keep that estrogen down, which in turn will help keep the fluid levels down. See, when you've got too much estrogen, the more estrogen you have, the more fluid your body will have. Where estrogen goes, fluid, where estrogen goes, fluid goes with it. And that's not a good thing. Again, big cause of PMS symptoms, bloating, the moods, sore boobs. Pretty much all blame it on estrogen. Yeah, not fun. So guys, it's the estrogen. So if we fix that up, I'm looking after the dudes here. It's a two-pronged thing. A lot of these same treatments that will help gearing you up to help with pregnancy, if it's also helping the PMS stuff, the life's fine and dandy. So, one way or the other. So yeah, the IUI. I don't know of a lot of clinics that still probably do that. Just monitor. A lot of them like chucking a bit of Clomid or something into the mix just to feel like they're doing something. But yeah, usually after so many goes on IUI, if it hasn't done the trick, then they really start stressing. Maybe you should look at upgrading to the IVF or ICSI. But like I said, there are other tricks maybe before you even think about going up to that level. But like I say, like we were talking about earlier, doesn't matter if you want to go with the IVF. There are so many things in natural medicines that can support you through it. Talking before about acupuncture, the success rate in a lot of people applying acupuncture in many cases, preconceptually and when they do IVF, it can improve the outcome greatly. Same thing if you do this. Sadly, a lot of the gynae, it's a different area of specialty. They say about, go to your doctor and talk about nutrition and stuff like that, but there's very few of them really have the same sort of education in that area. And I think they get a bit spooked about it. A lot of times, not to say, there's some really great ones out there, but sometimes if you're sort of seeing a specialist or whatever and they say, I'm seeing this naturopath or something on the side, some of them, they think, I've seen the witch doctor, and sometimes, and they start to go a bit strange on you, some of it. But a lot of it is just they don't understand how a lot of this can work. And I think it'll have to come to a day where if both orthodox and natural medicine can really amalgamate and work better together, because there's good and bad in both. And I think that's the thing. If you can pick that and give, it's all for the benefit of the people. It really is. I think there's no perfect solution, but I think if rather than butting heads against one another, if you can learn from each other, open your minds a bit more and look outside the square a little bit, there may be a solution to your problem, in the end. So, gone off track again. Any other questions you want?
Yeah, what's the cause of high levels of antibodies in sperm?
In the sperm, causes of it. Yeah, there's a lot of things. One of the main ones is probably getting urinary tract infections. This is a very, very common thing. See, men don't normally show symptoms of urinary tract infections like girls do, like cystitis, because guys have got longer urethras compared to the girls, so it's a lot easier for them to pick that up. But that's probably the most common example. Not only that, again, blockages. Blockage, yeah, varices is probably the next step to that. Because varices, there's, it's a state, things aren't moving very well, everything's sort of sitting there. It works a little bit like what happens when a guy has a vasectomy, when they do the ultimate chop.
That's like me if I had a reverse vasectomy.
Yeah, it's very, very similar to that, really, and that sometimes, as a very last resort, that's sometimes the sort of procedure they have to do to reverse a varicocele, and usually the problem will solve. But if you've had like a huge varicocele, but normally you could probably tell that because it'll be like a bag of grapes hanging there. But most guys, you would never know that you have it. Yeah, it's like after about between 5 to 10 years, if you've had a fairly significant varicocele, then the antibodies usually start to really climb. Same thing like when a guy had a vasectomy reversal. If it was done like more than 10 years ago, and they had a reversal, the likelihood of it's still possible, but the likelihood of that sperm being really super, probably not too good. But usually if it's before that 10-year mark, usually, yes, you have a lot of success for that. I've had a lot of guys that have had that done. Yeah, so blockages and like urinary tract infections are very common. They're probably, I think, on the top two of the list. So with varicoceles, again, if it's a minor one, we can help with that quite a bit. We treat it very much like a varicose vein.
What would you say with a minor one? What would, like your sperm production, would it still be viable sperm, or
the problem is when they do a sperm test and that, they come back, you might have very low numbers, on the motility might be a bit dodgy, morphology might be a bit rough.
About 3%.
The morphology. Yeah, that's getting there. You like it probably better than 10% would be nice. 15 would be great. But we've seen guys that have none, 1%, stuff like that, and we've been able to reverse it. But again, a lot of it's sort of not showing a true picture. Because you're going to have that and you're getting a bit of sperm, but all the good ones is probably backed up behind the blockage. It's like a big dam, really. Got this huge reservoir of sperm building up behind it. If we could just get to it, you could have more sperm, you could fertilise half the planet, really, right? So, but the antibodies are a very important thing. See, in IUI, they do a washing technique. In IVF, they wash it down, and sometimes that gets rid of the debris. Because the thing with the antibodies on it, it's a bit like a red flag to a bull. Like even if you had some antibodies there and you're doing it the old-fashioned way, and you still have good numbers in that, if you've got this sort of debris in the sperm, the woman's immune system eventually will start picking up on this, and you think, well, this is not right, so I'm going to take measures to deal with that, and it'll start attacking it. And if you keep doing that over time after time, same like with the IVF, keep doing that too regularly, you're going to get yourself into more troubles. So that's why sometimes you've got to back off, give yourself, say, a couple of months break, allow the immune system to sort of settle down again, then make your assault at it again. I know it's not ideal, and it's not really romantic, is it, doing it that way, but sometimes, you don't want, if you keep doing the same thing over and over and over and keep expecting to get a different result, that's not the wisest way to go about it. Sometimes you give it a good run in a reasonable time frame. If that doesn't work, you've got to back off and try something different. Even see a different therapist. Get another point of view. From it. Does that sort of make sense?
Just long. How successfully can you treat high antibodies?
Yeah, high antibodies, we can do a lot with that. Yeah. Again, if it's more due to a major obstruction, then that might require surgical intervention.
In my case, like I had undescended testes as a child.
Yeah. And you didn't have mumps or anything like that?
No.
Yeah, sometimes that is one of the funny ones. If there was one condition, more so as an adolescent. As a kid, not such a big drama, but as an adolescent, you got the testes didn't drop. Yeah. That can be a problem because it works the same thing. It holds the heat in. We've had other guys, I mean, you can't give guarantees, but we've had other guys exactly the same situation, and we have been able to help them out with that.
Mm.
Might take a little bit longer, you know, because that spermogenesis process, we've got to probably work on for a few extra months probably to see. But there's still a chance there, yeah. We need probably more info, but yeah, there's still ways around it. Yeah. If that makes sense. Any more questions? Do we cover? A few of the nutrients we're talking about with varices too. Again, when you talk about nutrients, like with prepping, again, this is something we get more into on an individual side of things, because like I say, everyone's in a different situation. You know, some of you just want to sort of get a bit of info about prepping, but others are at the other end of the stage. You've tried every other trick in the book, you know, and you're starting to get a bit disillusioned by the whole thing. That's why we need, you know, that's why it's very important to sort of tailor the right treatment to suit exactly what you're needing. But yeah, always consider getting plenty of vitamin C, guys, okay, if you're trying. You need about probably around 3 grams or so. And again, if you might suspect you might have a varicocele or antibody problems, always vitamin C is your first line of call. Actually, vitamin C is probably the single most important nutrient that is needed for every aspect of sperm quality, okay? But you know, there's nutrients like zinc, vitamin C, vitamin E. Actually, vitamin E, the word vitamin E in Greek means tocopherol, which means to bear with child. So it's been used for absolute centuries to help protect from, you know, miscarriages, and probably behind zinc and folic acid, I'd rank vitamin E with the essential fatty acids as in the top 4 most important nutrients for both couples when it comes to making babies. Okay?
Yeah. Moments, well, half an hour or so ago,
Yeah.
you got off track and you started
Yeah.
talking about vitamins, and you're back on it.
Yeah. Which
Right,
one?
so,
Good.
we-
Good. Keep me on track, because I'll just wander around.
Is there any particular brand like Barocca or Centrum or
Yeah, there's a few different ones.
that you'd recommend?
We're a little bit
prefer
different.
this Jason's concoction.
Well, no, there's a few. You should try that. Look what it is on your chest.
I've been told you shouldn't try it.
Yeah. You haven't done it first.
I don't know.
No, it tastes like crap. It does, it really does. It's nasty, that one. But they're actually working on a new version. But usually, from Multi's point of view, actually there's a few gynos that like using the Baroccas. I personally think they're great after a hangover, but I can understand the theory, because they also got bicarbonate in it, which is sort of good for keeping that acid level down, we were talking about before. Most of the retail ones, pretty good. I mean, you know, Blackmore still do some really good stuff, even though they're losing a lot of their product ranges here. Because see, a lot of the really good manufacturers are all being bought out by pharmaceutical companies last year, and they're pretty much taken over. And what's really sad to see is most of the really good products out there are all getting deleted, and just crappy generic stuff's been kept. You know, things all about the big bucks at the end of the day, the shareholders. I think. But see, we use mainly practitioner line range, because you find the practitioner line ones they go through much stricter testing and therapy. They have to go through Therapeutics Good Act, and it costs the companies a lot of money to get products registered. Just as an example, for like a men's multi, a really good one for the money is one called Multi Essentials, made by Bioceuticals. They do a good one. And they do a girls' version called Women's Essentials too. I really like those too. I use many different types.
Tressos B, is that a good
Tressos is great. Yeah, been around for ages. I actually got Tressos into the college I used to go to. It's get a bit old hat nowadays. It was really good, but no, it's still very good. You know, it's a good general one. But again, when you've got specific condition that you need to address, you know, there's horses for courses really, and maybe there might be a better option out there, which is really essentially what our job is. We're a bit like health brokers. You know, we're there to get the information, assess what you need, then we can show you alternatives. What I think would be the best ones to suit what your needs are. So we're there to sort of know all the different products from the different companies and steer you in the right direction, right? So it's sort of really training you, you know, what's good for you, rather than using something generic.
Do you do all the blood tests and everything?
Do a few, don't do as many nowadays, but you know, we can definitely get them done if you need to. Sometimes it's easy because they've changed a lot of the laws now with naturopathy, where they've made it very difficult, you know, with the health funds and that, getting refunds for that sort of thing. So sometimes it's easier to you get a recommendation from your GP to get certain tests done. I mean, there's certain specific ones we can get done and get sent away, and mineral tests. There's all these different ones we can do. But yeah, we use it. But usually we do that when we think it's necessary. Usually probably not necessary for the first visits or so, but we'll deduce from what we get from that information, think, okay, there's something missing here, then we'll probably recommend, yeah, we should do this test. Don't do too much of the live blood tests anymore. Used to have the machinery years ago, and I think it's very interpretable, I think, the results, with that. So, yeah.
So if a man's really lacking in zinc, can that cause, poor morphology and stuff?
Yeah, zinc's the most important area of the lot. See, here in Australia, we're the most efficient continent in the world with zinc in the soil now. A lot of it's mainly because of introducing all the European farming methods over here, and stripping the topsoil and stuff like that. So probably in the last 30, 40 years, the zinc content in a lot of the produce now is about 50 to 80% less than it used to be. That's what the CSIRO seems to be saying. So that, again, if the food quality was like what it used to be back in Mum's day and Grandma's day, there wouldn't be a lot of need for this sort of stuff. Most of them just looked at one another. I mean, look at the size of the families they used to pump out, Well, especially here when you own a farm, you either have a kid for kids, you might lose a couple, keep out there growing the crops and stuff. It wasn't uncommon. Like people of very wealthy, stately people back in the 1800s, it wasn't uncommon for the women to have like 20, 30 kids. Again, there was no contraception back in those days. They pumped the baby. They would have had like a wet nurse or something. Maybe a peasant woman lost a baby and she would breastfeed. As soon as she gets off the slab from having baby, bang, she's pregnant again. And it was actually of the more babies they had, the more higher stature they had in society. It wasn't uncommon for guys. Back in the other days, we were talking about gender selection. God, thank God this is falling out of favour. They used to actually have like one of their testes removed. Someone of gentry that wanted to sire like a male heir to their estate, or even less extent, had a bit of a rope tied around it to choke it off. So thank God that's gone. And it wasn't uncommon, like with the girls when they were giving birth. They were in the barns and that, and they had to tie a bit of rope around the old man's old fella. He'd be standing up on the rafters every time she has a contraction. Yeah, she yanks down on the old rope. Talking about sharing the pain. So it's all that sort of stuff. Yeah, so no, there's all these different things here. Any other specific one?
Yep, so we got Jason, question 1. I suffer from PCOS or otherwise known as polycystic ovarian syndrome. I was just wondering if you have managed to help ladies with PCOS to fall and have full-term pregnancy.
Maria was originally a patient of mine years ago for PCOS, and she's had 2 since then.
I was told I'd never.
Yeah, she was having a few dramas.
A baby naturally, so that's what the doctor told me, and I went and saw Jason and he said that's a load of crap, so...
Probably not so... Well, probably
yes,
did say that.
Yes, he did. And gave me a bottle of these lovely herbs that he blended up for me, and then within 3 months the LH level that was elevated had halved. I went back, the doctor said, how the hell did that happen? And I said, oh, well, I've been taking some herbs. Oh, no. No, that can't be it. And I said, well, I think it is it. And yeah, and then from then on I went to have monthly cycles, and yeah, okay. And the second time after the first, 3 months. and I had horrible weight gain, even from my knee, I just was gaining weight, it was shocking. But once I got pregnant, lost the weight because the hormones went normal. And
you had a good pregnancy, didn't you?
You
didn't really put on any weight.
No, 3 kilos I gained only from like the last few weeks. I actually gained 3. And so I was lighter after I had the baby, so I was lighter. And second time when I wanted to have a baby, I fell pregnant within the 3 months. So with Jason's help again, so it was a lot easier the second time. And that was 6 years of infertility. Yeah, 6 years of being told that, putting on clothing, turning me psycho, and yeah.
There's some really good examples in the book. Back in the book, we just picked a few case studies. People have been really nice over the years and provided a few of their stories. And we just chucked in a few different variations of stuff, what they've gone through. And most people could pretty much probably equate, because that's the hardest part. You feel very alone and isolated when you're going through this. you know, especially when you've been in it for a long, long period of time. And it is a bit like trying to, you know, climb Mount Everest for some people. And it's nice to sort of realise that, you know, actually it's becoming part of the majority now. Actually, you'd be surprised. Again, like we're getting close to 1 in 5 couples clinically recognised as infertile, and that's getting worse and worse and worse. So it's sort of one of those things you don't sit around and talk about at the coffee table all the time. It's sort of, you know, it's something that you tend to keep very personal to a lot of people.
But the girls, even in their 20s, and the guys in their 20s.
Shocking. The PCOS, you normally find most of the symptoms usually probably kick in more in your late 20s. But the girls are getting younger and younger, and they're more severe, more severe. And you think, what's going on? I mean, yes, the testing methods are definitely getting a lot better, and the doctors are becoming more educated in understanding it. But again, what's happened since Mum's era to this era? Even when I started studying all this, PCOS was really, most of the doctors didn't believe it. It's a bit like chronic fatigue syndrome. It was one of those things that,
I asked the doctor whether I had it, and they didn't know anything about it. I had to give them a study on it. They didn't even know.
It's a bit scary in some areas. Orthodox medicine has sort of treaded water a bit, and some of the natural areas have definitely leaked out. Even though our foundations date back thousands of years, and the fundamental principles in many areas, we're probably about 5 years ahead in many areas. And it's frustrating a lot of the time, because we're talking to a lot of gynos and stuff like that, you know, and they keep saying no, can't be this. But we think, you know, that's just old thinking. You know, that's stuff that we used to do. You know, thought, you know, time to catch up. You know. But no, PCOS is really it's really probably close to the #1 thing I see. And again, because it's such a multifaceted condition, and you know, nearly every endocrine gland in the body is usually affected to some degree. That's why I think in orthodox medicine they find it very hard, because they give you one drug to sort of treat one area, you know, and where again that's not really this. Yeah, this condition really sort of is a bit beyond some of the orthodox's approaches. You know, they look at hitting it. It's like trying to pat a flea with a hammer. You know, if you do that too often, you're going to have a squished flea, and then you bug it. But you know, there's a lot of tricks you can do. Like I said, it's one of those ones that does usually require a lot of consult, like a formal consultation with that, because it is such a big area. I mean, the book we cover a fair percentage of what you want to do. But if you had to think of a particular condition, it's one of those things that you need to sort of deduct, because you get a real gut instinct in knowing what sort of level of treatment level you need to come in at. That's why everyone is so different with this. And I think, you know, when you've been doing it for so many years, you hopefully start to get to read people pretty well, and you tend to hopefully be able to tailor it right on the money.
You know when I don't take my tonic, don't you?
Yeah, thanks, man.
That was my question. Like, how do you maintain that now? What's your management plan to, maintain that condition?
When Jason will make me up a tonic when I know my hormones are going out of whack, and he'll know by the PMT in the office, and he'll like, you haven't been taking your tonic. No, I haven't. But no, I don't know, like, but since I had my second baby, I breastfed for 2 years, so that took a bit of, the hormones. Yeah. And then once I stopped breastfeeding, I just dropped 15 kilos again. So the hormones in my cycles are monthly, but they were starting to go out of whack a bit for a few days. So I've had to have a new tonic again. But
yeah.
Is that what you treat when you're treating ovaries? Because I have really low progesterone.
Yeah.
My estrogen levels fairly
really high. Yeah. That's usually the way, and that's usually the most common, because most girls with PCOS, like Endo, that most of them are really estrogen dominant. And that is the root of so many evils, is that.
But I have a normal 28-day cycle.
So that's good. That's really good.
And the doctor says that I ovulate, not very often.
Yeah, so it's still a little bit more sporadically, and a lot of that's because of that gap that's sort of surging here. So, but that's the thing. If we can just sort of, it's a bit like a graphic equaliser. If we can just bring that progesterone up, they'll hopefully naturally bring that estrogen down. Hopefully if we get a few cycles back to back in that sort of rhythm pattern, hopefully then it's starting to retrain your circadian rhythm to think, okay, this is what should be normal, and do it. See, Clomid sort of does it in a roundabout way, but it just absolutely smashes it every time. And, you know, that's great. Like I said before, if it works off the bat, you know, cheers to you, but, you know, it's a catch-22 a little bit sometimes. You know, it's one of those things personally, from my perspective, you would probably leave that as a very last resort. If you try, you know, these are just some of it, you know, we've got tons of stuff, we've got a huge dispensary, we just make stuff. Yeah, you try other tricks first. You know, you've got to come at a certain level, give that a reasonable time frame, and you'll tend to know, okay, what changes you should expect to see with what treatment protocol that you're doing. If you're not seeing those suspected changes, or you think, okay, we've tried every trick from our point of view, maybe then we might have to bring in a bit of Clomid or something else to just kick-start things, then we can work supportively after that just to keep the momentum going, you know, so.
When I first started trying when we were 19, and everything was all over the place, but as I've gotten older, my symptoms have become worse. But my cycles are 21.
Really good. So that's good. I mean, because that's something we can work from. Yeah, you can, because that's good. So normally it's the opposite. You know, normally periods are just not happening, non-existent and stuff like that. But that's why sometimes we talk about getting blood tests and stuff like that. Sometimes it's nice maybe initially in those sort of situations to do some preliminary, get like a full hormone function test done, you know, maybe get a thyroid function test, you know, something like that, just so we can see, just to make sure that maybe something hasn't been missed. You know, about $1 for each time that happened, I'll be kicking it in Tahiti.
So what happens if you've done that and it's all come back? They were convinced I didn't have polycystic ovaries.
Oh God!
I was told for 14 months I didn't have polycystic.
Is that right? Yeah. Well, I've been told that many times too, and I think they just don't read it.
With 2 ultrasounds too.
Is that right? Yeah. Like I said, you don't have to have any cysts at all on the ovaries.
I've grown cysts when I was 20. I didn't have any. But
see, some of them could be follicular cysts, the big ones. If you're getting a little, if you're really getting the little ones, you've got PCOS no matter what. But it's really the hormones. If your LH is higher than your FSH at a certain, you know, generally in the second half of your cycle, you got it no matter what. You know, you may not have any other symptoms, but you do have a degree of it. I mean, that's why it is a spectrum. Yeah. It is really, like I say, PCOS, everyone's different.
Yeah,
totally,
I never had any acne. I don't.
Totally different system. It's a very broad thing. It's like saying cancer. You get cancer.
So everyone's different.
What type of cancer? You know, it can be any type of one. You know, so yeah, you've got to really be very specifically treated. But sometimes you do have to pull out the big guns and go up to some of the stimulating drugs just to get things kick-started. But even if you have to resort to that, we still can work around it and help support all the other stuff. No, because it's all about
Clomid, is that what you're talking about?
Yeah, because you want it to do its job, but then again, you want to get it out of your body. It's a bit like chemo. You know, you want it to do its thing. If you're a cancer, you want to kill its cancer, but then you want it out of your body, so your normal cells can then function quicker. You know, type of thing. So, because cancer is the other big thing we work with too. So, it's so that's a huge thing. But yeah, we can get into a few tricks. Yeah, we've got a lot of.
Question. I've heard that lubricants kill sperm. Do you know of a safe one to use?
There's a few different ones. Pre-seed, if it's around. Silk's another one. Yeah, that's probably the second one. Pre-seed's been a bit hard to get.
That's hard to get. Silk's
Silk's a really good one. Yeah, because the lubrication side of things is a very, very important thing. That's another reason why a lot of people sometimes are probably advised to go with IUI. Sometimes if the lubrication's not too flash. Because a girl produces 4 different types of mucus throughout the month, and the fertile mucus, they call that spin, it's like the egg white, which is a very good time to tell if you're going to ovulate or not anyway, because a lot of girls, if they're not getting that nice sort of clingy, where the other stuff like at the end of the cycles and before your periods, it's more like that super glue. I'm just trying to find an example, it's a bit, the guys don't know this. Secret women's business. Don't let them in on the future. Best not to know.
Conceived Plus is what we use.
Yeah, Conceived Plus is another one. Yeah. So they're probably the top 3 that I would probably recommend. But yeah, the lubrication side of it's a very, very important thing. Even good old saliva can have trouble. I'm not going to explain how that.
We touched on the varicocele one. What options are there for a varicocele? You've done that?
Yeah, a few things, but yeah, I mean, just quickly, just a few of the sort of herbs and nutrients you can use for that. Again, you usually use really high doses of vitamin C and E and stuff like that. There's particular herbal medicines that you use, sort of the way like you treat a varicose vein. There's herbs like known as horse chestnut, gotu kola. There's one called Dan Shen, good Chinese herb for stagnation. Great for girls, you know, with the endometriosis stuff and all that, and PCOS. In PCOS, we mainly use herbs like, I won't test you, but there's ones called peonia, black cohosh. Tribulus is a very good herb used for both sexes. If girls aren't ovulating very well, tribulus is a very good herb to use. There's other herbs like vitex or chase tree. Again, there's all different qualities and standards. So, and it's a difference between using practitioner stuff, say compared to your over-the-counter gear. You know, it's much, much stronger in many ways. Peonia is a great Chinese herb. These are just the common names.
Do you use Vitex a fair bit?
Yeah, a fair bit. Vitex is best used sort of around just before ovulation and in the second half of your cycle. Sometimes if you use Vitex all the time, with girls that have PCOS, it can actually stop you from ovulating. See, it's all these little tricks you've got to know. Some people put you on it all the time, but it sort of works a bit like the Clomid. You do your normal stuff, then you chuck in a bit of Vitex sort of just before ovulation, and it sometimes can be just enough to, nowhere near as strong as what Clomid's going to do, but it could be just enough to...
So we're meant to only take it just before you...
Yeah, so say probably from day 12 or something, you know, a few days before, yeah. Because sometimes if you take it too much, it can prevent you from ovulating. Vitex is one of those sort of female herbs that it's a bit of a catch-22. It can be great in PCOS, but it can also have some downsides as well. Again, it's all about the timing. And Vitex or chase tree, you should really take it in the morning, that one, because it's there to mainly support your progesterone, so it's a good one. But again, you've got to do it at the right time. Yeah. Herbs like peonia helps to clear androgen hormones, because another thing with girls that have PCOS is the LH hormone that they make a bit too much of, it stimulates the ovaries, the adrenal glands to make too much of a hormone called aldosterone. Aldosterone's a bit of a cousin to testosterone, and obviously girls don't really want to make too much of that. So some girls may be prone to hirsutism, they get the increased hair. The acne. The acne is caused by the aldosterone overstimulating the sebaceous glands of the skin and causing the skins to inflame and block up. That's how you get acne. Just like in puberty type of thing.
So what do you take to stop that?
The hirsutism.
Yeah.
Hirsutism's a little bit harder because you've got to sort of balance the other stuff. But I guess a lot of that, there's droplet formula there's one called hormocrine, which actually has dilutions of all the different hormones and stuff like that. It's been to be, I found it really effective with hirsutism and stuff like that. Again, there's heaps of stuff. Actually, the book's got tons of info on acne treatment and stuff like that with the PCOS and all that sort of stuff. With acne, you use, particularly herbs, there's ones like calendula and burdock. They actually dry up the sebum to stop you from breaking out in the first place. And it cleans the bloodstream out. In natural medicines, we use things called blood depurifiers. These clean the muck out of the blood so it doesn't get diverted and overburden your skin. So that's getting off things a bit. Yeah.
Sometimes I use that proactive.
Yeah, proactive. How's that been? It's good for a while. All my kids use it.
But some people say don't use it if you're pregnant.
Yeah, I'd be a bit sus on it.
Because there's something in it.
Well, like the big treatments, like Roaccutane and stuff like that. My missus had really bad skin, and every time she fell pregnant, she couldn't take it, because it can actually cause birth defects, for many, many years, even after stopping it. So don't think about that one till much later. Yeah, proactive. Most of my kids have used it. They did okay, But again, it's not an external problem. It's an internal problem that's coming out. It's like most skin problems, unless it's contact dermatitis. Okay, we're getting off the tilt, but it's usually because of this hormone imbalance. It's really just affecting the sebaceous glands. you fix the cause, you get down to the origin. That's why, again, that's what natural medicine is about. You get be a bit like a detective. You've got to trace the steps down, get an idea what the origin of the problem is, then work back from there. And then, yeah, it's a bit more than using orthodox medicine. They bypass all that, just go straight to the symptoms. You know, it's not all about just band-aiding symptoms. It's about teaching the body to regulate the cause, and hopefully then the body will take care of itself after that. So, because if you think of health in the spectrum, like you've got death here, ultimate health here, which is pretty much unattainable, but we'd like to. By the time most people start seeing the doctor or start getting symptoms, it's usually when we're in the middle here and we start heading towards the big end of days, basically. But usually once we start getting symptom-free, then we just go back to our old lifestyle. In a way, natural medicine is a bit like a way of teaching people to live, in a sense, by a bit like a sports coach, really. If you try and push more and more down to the spectrum, and that's where exercise and diet and all that comes into it, that there's less likelihood, you could really go out and flog yourself a bit before you really start slipping back into any symptoms. And it's the same principle, again, with fertility, because it's an endless sort of area. And in a way, if you use a bit of a scattergun approach, like we're talking about those 4 big areas, the genetics and all that earlier, if you essentially put a foot in all those fundamental areas, you should have, most of the works really essentially should be done by then. You should have really covered your bases. And I think it's a dogmatic law that you sort of stick to. And it's something I've been lucky over the years, not just myself, but other therapists in the industry, and you observe, see what other therapists do around, and you nick good ideas from them. Everyone does it. And again, and you amalgamate, and then you find your own way, put your own little twist to it, And most of the time, you seem to come out at the end with the result, So.
Okay, another one. What can be done about sperm motility and morphology?
Yeah, that's one of the biggest areas we're seeing, one of the biggest problems with at the moment. Morphology is one of the hardest things, and this is why it does take quite a few months, because you've sort of got to work from the very, very beginning to get the turnover. So motilities, again, a lot of it depends on what's causing it. If it is due to an obstruction, like a varicocele, then we need to probably know that and work on that side of things, like some of those things we were talking about before. There's a lot of, even Chinese herbs like astragalus is very good. Most of the, what we call adaptogen type of, herbs, a lot of your ginseng-y type of herbs are very good. Panax ginseng, Korean ginseng, Siberian ginseng, ashwagandha, which is withania, which is a great names then. That one's called Indian ginseng. It's great. We chuck withania in everything. Really good, especially when you're burning out from stress. It's great, because one thing that'll bugger a guy's fertility is stress. That's really, as it does for the girls, but for guys it really, really impacts it. And these sort of the things that are telltales on. Girls that get blocked fallopian tubes, we were talking about before about chlamydia and stuff like that. Stress is the #1 thing that will stuff up the motility of your fallopian tubes. So stress is something we really always seem to address. Even though you don't feel stress, there's a difference between physical, like emotional stress and physiological stress. Again, if you're going through a big issue like fertility, you're going to be having a bit of both somewhere along the line. So again, you cover for all possibilities. And we cover behind the scenes. And again, if it is like something going on, when you've been trying so hard for so long, it's got to start wearing you a bit thin. And it's very important to work on that. So the morphology, there's a couple of supplements we use. There's a tablet. So for example, we use many, but there's one like MitoLift, MyOrthoplex. It's got all your sports nutrients like your creatines, lipoic acid, all your extra folic acid, B12, coenzyme Q10, all these type of things are in there. So they really help to protect the genetic load of the sperm. And we sometimes use that for the girls as well. What other things other herbs sort of use for that? The tribulus was a good one.
So how long do you tend to treat a man with low morphology?
Well, usually the essential breakdown, if it is down, you're going to probably have to get at least 3 months, regardless. Then usually, not to say that the sperm quality and all that's not going to improve in that time frame, but that's just the nature of how the body's physiology works. You can't really jump too many stages when it comes to making sperm. If it was the world